Two. Checking connection.
All right, and we're live. All right, hello everybody. It's Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl, where I get to answer all of your plastic surgery questions, and it's coming from a reliable source because I am a double board certified plastic surgeon, and also did my residency at Duke, one of the top plastic surgery programs here in the U.S. All right, so today we're going to go straight to questions. We're going to keep things a little bit shorter because I actually have to prepare for a big conference we're having this weekend, which we're super excited about. We're having the WAGS, the World Association of Gluteal Surgeons conference this weekend, and I will be presenting on Saturday. So I have to prepare for that. I'm going to be talking about all of the experience we've had here at Pure regarding ultrasound guided BBLs, which is the way to make BBLs safer. All right, so happy to answer all your questions. It could be anything plastic surgery related, and let's get into it.
Do you see a benefit from BBL patients who doesn't sit for more than the recommended 6 weeks?
I haven't really seen that, okay, at least in my experience. So what is my experience? So about 3,000 BBLs, 2,000 of them under ultrasound guidance. And for all those patients, I have them avoid sitting for 6 weeks, and typically that is enough. Just think about it, bringing it back to like fat physiology and how that fat that we transfer, how that survives. 6 weeks is certainly enough time for the whatever fat cells that we're going to survive to have reestablish basically new capillaries, new blood vessels, new oxygenation, and that's really all the time that they need. And then after 6 weeks. Pretty much whatever's going to survive is survived, and whatever's going to be absorbed is absorbed at that point in time.
Doctor, do you record on each ultrasound BBL?
Do we have a recording? Yes. So that started with the mandate or the emergency order that we had here in Florida last year. And so part of that mandate was that you had to have a recording for each patient. So of course we started doing it at that time, and even though that emergency order has expired back in September of last year, we thought it was a good idea, so we continued doing that. So you do have basically a recording of the ultrasound performed during your BBL for every patient.
Doc, what would be the average healing time for a chin lipo?
So for chin lipo, chin lipo is tough, all right, guys. It's tough because the garment is so annoying, okay? And I get it, I understand. It's super annoying to have this thing wrapped around your face that everyone can see, and it's very, very uncomfortable. But it's also very, very necessary, okay? So what I tell my patients is that in the first 2 weeks, you really have to have that on at all times, night and day, okay? I mean, would it be the most ideal world? In the most ideal world, you have that on for 6 weeks, but of course, no one's going to tolerate that, and so I get it. But first 2 weeks, try to leave it on as much as you can, and then after that, you want to try to leave it on as much as you can where you're not kind of facing people, right? So when you're in the house, certainly at night while you're sleeping, when you're not face to face with people, just have that on during those first 6 weeks, okay? And then after 6 weeks, you can then stop it altogether. But that does not mean that you have the final result at 6 weeks, okay? Just like any other area where we do lipo, it's going to take at least 3 months to see the final result there for all the swelling and inflammation to go away. And if we use the face type, okay, remember, face type, body type, any of those, it takes 6 months to see your final result. 6 months, okay?
Doc, how do you feel about the Colombia look? Like small waist, big booty, and tiny waist. Are you open doing that? Because it seems you always do a natural look.
Yeah, I mean, my style, and those who've been following me for a long time, is more what I like to call an enhanced natural look. And the reason why I do that is because I can tailor that look to every patient's very own unique foundation, right? I'm not trying to do something that just does not go with that patient's underlying body, underlying frame, skeletal structure, etc. And so we're certainly enhancing the look of the patient, but it's a very long-lasting type of result, right? This is the type of result that if you have your BBL in your 20s, and of course you don't have any major life changes, you keep up your nutrition, you keep up your physical activity, no pregnancies, etc., etc. But the point I'm trying to make is you can have it in your 20s and you're still going to be very happy with it when you're 50, when you're 60, etc. Okay, now when we go for the more dramatic looks, okay, well, typically, because nowadays we're only placing the fat in that subcutaneous safe space, it typically takes more than one BBL to really achieve that type of a look. Okay, so you're committed now to like multiple rounds. All right, and we're seeing a lot of people wanting BBL reversals right now. Okay, I mean it's just a reality, and so that we're seeing that grow and grow and grow. We're starting to be known as one of the centers that actually does this well. BBL reversals, BBL revisions, basically bringing down the hips a bit, breaking down the booty, because while that type of look looks can look fantastic in your 20s. There's a lot of patients later on in life in their 40s or their 50s where they don't really want to be sporting that look anymore. So I know it's a very roundabout way of answering your question. So can it be done? Yes, it can be done, but you have to put all these things into consideration.
Greetings from Palma de Mallorca.
Oh, all the way from Spain?
Yes.
Nice. All right. Is that Lucy?
Yes.
All right. Hey, Lucy. How you doing? Hope you're having a great time.
Yes. When did you get the lymphatic massage after mommy makeovers?
So you can start as soon as the next day as well. Okay. And I do recommend lymphatic massage for mommy makeovers, but it's not as many or as intense as when you do a Lipo 360 or BBL. Okay. The main focus of the massages after the mommy makeover are along the flanks and the waist, where we do the liposuction, and the lower back. You can ask, why the lower back? Nothing was done there. Well, because when you do a tummy tuck or a mommy makeover, you start walking hunched over like this, and you start to develop some like spasms, some pain, lower back pain, and so the massages really, really help relieving that pain. Okay, but you can start, like I said, as soon as the next day. The first, I would say the first, 4 or so you should have daily. Perhaps after that you can start spreading it out a little bit more. And you should do a total of, 10 to 15 at least.
Okay. Do you do the hidden incisions technique?
Yes. So I'm not sure if you've heard me talk about the South Beach butt lift, right? That's our signature basically butt lift that we have here at Pure Plastic Surgery, only available here at Pure, and it's our own take on the BBL. And one of the big important differences about that is less incisions and hidden incisions. Okay, so that's really what it's all about. So in the front, the incisions are all kept very, very low in that suprapubic area. One is tucked inside the belly button, never going to be seen there. In the back, you're going to have one in between the butt cheeks, which again, easy to hide even in a tiny bikini. And then, we can hide the other ones kind of in the armpit area. Once again, if you're wearing a tiny two-piece bikini out on South Beach, nobody's going to notice. They're never going to know.
Okay. How long after getting a BBL will the drains be removed?
So these drains are removed on post-op day 5, okay? Which is the day that you come here into the clinic for your follow-up appointment. So on that appointment, you're gonna come in, where of course we're gonna check on you, make sure everything's doing okay, we're gonna check your vitals, and then we're gonna go ahead and remove the drain and the stitches. So we remove all the stitches on post-op day 5 as well. So for Lipo 360 BBL, you should not be, I would say 99% of the patients, you're not going home with the drain.
I'm looking into a BBL and hip reduction and came across your
there
page.
you go. Okay.
Will my skin sag? Is it not super big, but I want it more natural. Natural.
So I'm so glad you asked that question, because we just talked about this a couple minutes ago. It depends on the skin quality and how much we need to reduce. Okay, so I think if you have fairly decent skin quality and the reduction is not super drastic, then the skin does well and we don't need to add anything to it. Now, if we're looking for perhaps a little bit of a more drastic reduction, or you're, say, a weight loss patient or something where the skin quality is not great in that buttock and hip area, then I would recommend adding Body Tight to help with the skin portion of it, right? So liposuction helps reduce volume and reshape, but then if we're thinking we may have some issues with the skin bouncing back, then let's add that Body Tight to help that skin retract.
The last one, Doc. Do you do drains on a breast leaf or breast augmentation?
I don't. So I don't use, it would be extremely rare that I use drains for any breast procedure nowadays. I'm not going to say it's impossible, right? You know, it's not 0%, but very, very rare. So, but yeah, for the overwhelming majority of my breast lifts, breast reductions, certainly any, implant cases, I'm not using drains. Really, the only procedure where I use drains where they're mandatory is your tummy tuck.
That's all for
Okay,
today.
that's all we got for today. All right. So yeah, today was a little bit short and sweet. Like I said before, we're preparing for that big meeting. We're gonna be getting some videos, getting some clips, showing you guys there what's going on. It's really, really exciting. We're gonna be talking about everything related to fat transfer, new techniques. We got people coming in from all over the world. So it's not just like Florida or Miami. We got people coming in from all over the US and Canada, Colombia, Mexico, some of the Caribbean islands as well. So really, really cool. All right, so guys, stay tuned. And I'll catch you all next week for Hump Day with Dr. Alex Earl. Ciao.